Hi, I'm Dirk Blom. I work at the Groote Hospital Lipid Clinic at the University of Cape Town in South Africa, and we're here at the EAS meeting in Madrid. And there's been a lot of new information here on familial hypercholesterolemia and novel treatments for familial hypercholesterolemia. And one of the particular interesting things that we've heard is about the treatment of homozygous familial hypercholesterolemia. Now, in South Africa, we obviously have a particular interest in patients with familial hypercholesterolemia because of the founder effects. So, familial hypercholesterolemia is highly prevalent in some of our populations, and we find FH in some populations, the heterozygous form, about 1 in 70 patients, and homozygous FH may be found in up to 1 in 40,000 patients. So for our country, it's certainly a real problem. We have quite a large number of patients, but homozygous familial hypercholesterolemia still remains a very difficult disease to treat. Even with modern lipid-lowering therapy. Up till now, the standard of care for these patients has been a high-dose statin, ezetimibe, and then lipoprotein apheresis or plasma exchange. And one of the big problems in South Africa, and I'm sure in many other developing countries or middle-income countries, is the access to apheresis. So apheresis is a relatively expensive therapy. It requires a hospital, requires the technical setup to perform, and so many patients are not accessing this therapy that is saving lives. So what is very important is that some of the novel therapies, they are either oral or injectable therapy, so these are much easier to apply, much easier to spread in a population. And what we really have to focus on is to get these therapies out into our country and into other countries. Because although other low-income countries or middle-income countries may not necessarily have founder effects, there will still be patients with homozygous familial hypercholesterolemia. So what these countries need is the necessary expertise to identify these patients, to find them, to diagnose them, and then to start treatment.